So it's basically well known that health-related quality of life of persons with MS is generally lower compared to the general population. However, there are still many gaps in the understanding of factors that influence health-related quality of life of persons with MS, especially when it comes to non-clinical factors such as living situation, the socioeconomic status, or also lifestyle factors. And so these factors have been largely neglected so far when looking at influences on health-related quality of life of persons with MS. So with our study, we actually wanted to extend on previous research in order to better understand factors affecting especially low health-related quality of life in persons with MS. So for our study, we used data from the Swiss Multiple Sclerosis registry. That's an ongoing longitudinal study including persons with MS living in Switzerland. And the registry relies on self-reports and mainly collects data on health-related quality of life and lived experiences with MS. So we considered all participants with a complete health-related quality of life assessment as measured by the EQ5D and visual analog scale. Then we decided for a quantile-based segmentation approach to classify all participants into 3 health-related quality of life groups based on their health-related quality of life assessment score. And by doing so, we were actually able to remove the effects of age and MS disease duration, which we knew to be factors influencing health-related quality of life. And also the approach allowed us to categorize participants into these health-related quality of life groups without any preconceived notion of what is a good or bad health-related quality of life. We then specifically looked at factors that are associated with low health-related quality of life. And besides MS severity and gait impairment, we found several MS symptoms to be associated with health-related quality of life. And these symptoms actually included depression, pain, memory problems, muscle weakness, as well as fatigue. So first and foremost, MS management requires individuals with unexpectedly low health-related quality of life to be easily and reliably identified. So we think that the distribution-based segmentation approach that we used in our study may be of an advantage in this respect and therefore offers greater clinical applicability. But based on our findings that symptom burden seems to play a crucial role for health-related quality of life, improvements in MS symptom management may be needed to preserve or even improve health-related quality of life of persons with MS. So what we still don't know are the long-term effects of the individual factors on health-related quality of life or even long-term health-related quality of life trajectories. And moreover, we think that health-related quality of life goes beyond MS symptoms and severity, and there is still a need to close some knowledge gaps on health-related stressors that are not tied to MS symptoms or physical impairments. So actually, we also want to conduct longitudinal analysis. So in this study, we only worked with cross-section data. But given that we have data from the Swiss Multiple Sclerosis registry, where we have collected longitudinal data for over 2,000 participants, we plan to conduct a longitudinal study to explore changes in health-related quality of life over time.